Hello viewers, greetings to you. Welcome to Excel Health Arena, and my name is Adeola Adegoke. I have been talking to us about family planning, and we've talked about barrier methods. Now we're talking about hormonal methods, and on hormonal methods we talk about pills, different types of pills, and we were on emergency pills or postcoital pills, and I said failure rate is about 1%. Now the side effects, usually you could feel nausea, vomiting, in extreme cases you could feel you could vomit. Then there could be mild stomach upset, there could be headache, there could be tiredness, sometimes there could be spotting. Spotting is when there is a little bit of drops of blood, on the palms. Usually it is just observed on the palms. Okay, now another pill that we're going to talk about is once a month pill. That is a long-acting pill which contains long-acting estrogen and short-acting progesterone. In this kind of pill, the pregnancy rate is high. Actually, it's not so effective compared to other oral contraceptive pills. Then there could be irregular menstrual cycle. Let's take note of this. And I also told us earlier that good news is that men can also take oral contraceptive pills. So the oral contraceptive pills in male is the one that reduces the volume or quantity of sperm that is produced by the man, and it also reduces the potency, the strength of the sperm. So when the sperm is not strong enough, if it is very difficult for the sperm to be able to fertilize an egg. So usually that is how it works. It decreases sperm count, but it does not affect testosterone levels. Ordinarily, it doesn't affect testosterone levels. It's just that it reduces sperm count and the strength of the sperm, and at the end of the day, the sperm will not be able to give to fertilize an ovum. So a man will not be able to impregnate a woman. And one side effect that needs to be taken note of is the fact that when it is about 6 months into the usage, there is possibility that in about 10% of men there may be permanent azoospermia. Azoospermia means the strength of the sperm is weakened. So even subsequently, when the person produces sperm, the sperm is weak and is not strong enough to fertilize an egg. So the person may not be able to get a woman pregnant, except some other drugs are now taken possibly to strengthen again, the sperm for him to be able to impregnate a woman if he wants to. Okay, so it is usually not on practice because naturally most men will not want to consider that choice because they will feel insecure that so if it can reduce quantity of sperm, if it can reduce the strength and agility of sperm, so what if I eventually want to get a woman pregnant? What happens? So for that reason, it may be difficult to convince a man actually to go for that kind of method. Okay, so the advantages of oral contraceptive pills: it prevents pregnancy, it makes menstrual pain easy a lot. It eases menstrual cramps that usually comes maybe days before menstrual cycle. Sometimes in some people it also extends to few days even into the menstrual cycle, and it also regulates the menstrual period. If you follow me with the way I analyzed the use of oral contraceptive pills, daily pills like that, till the time that we take the 21st tablet, then 22nd tablet, the iron tablet, which eventually leads us to menstrual phase in the cycle. So in a way, it regulates the menstrual period or menstrual cycle. Sometimes when women have some other complaints, such drugs or such medications are prescribed for them. Oral contraceptive pills are prescribed for them for them to be able to regulate their menstrual cycle back to normal. Okay, so there is also the possibility of decrease in ovarian and uterine cancer. Also, it reduces acne, what we call acne, ifo, tamangpe ni ifo on the skin. For a woman that takes oral contraceptive pills, chances of acne may be very reduced. And these pills prevent, occurrence of about 6 diseases in general. The benign breast disorders, ovarian cysts, even iron deficiency anemia, they prevent it. Pelvic inflammatory disease is prevented. They prevent ectopic pregnancy, ovarian cancer, all those. The chances are very, very minimal when a woman is using or taking oral contraceptive pills. Now, 100% oral contraceptive pills are effective when used effectively, when used right. Okay, now there are some contraindications. Contraindications means do not attempt to use them, though sometimes contraindication could be very strong contraindication or relative contraindication, but most of the time you don't want to do those things, or strictly do not do those things. So when we say contraindications, we're talking of things that, conditions that if somebody has, you don't think of taking oral contraceptive pills. That is cancer of the breast and the genitals. That's maybe ovarian cancer, cervical cancer, like that. All those cancers, for the woman, please, a woman should not take it. If there is history of thromboembolism, don't take it. Cardiac issues, cardiac abnormalities, don't take it. Abnormal uterine bleeding. When there is abnormal uterine bleeding, it's, don't take it. If there is hyperlipidemia, especially congenital one, high lipid in the blood, high level of fat in the blood, hyperlipidemia, please, it's a contraindication, don't take it. Usually when women are above age 40, above 40 years of age, you want to say that they should avoid taking oral contraceptives. Smoking is a contraindication. Okay, mild hypertension, when a woman is hypertensive, don't take oral contraceptive pills. Try to think of some other methods. Epilepsy is also a contraindication, don't take it. If a woman has migraine, we know what is called migraine, very severe headache like that, don't take it. And of course, when women are breastfeeding, lactating mothers, do not take oral contraceptive pills. Okay, so now adverse effects. Generally, when we want to look at contraceptive pills and we want to talk about adverse effects, there could be cardiovascular diseases, there could be risk of breast cancer, as I've said, there's risk of cervical cancer, ovarian cancer. There could even be risk of thromboembolism. There could be risk of thromboembolism, liver problems, liver adenoma. There could be lipid metabolism disorder. All these things could be side or adverse effects. I will even call them adverse effects of oral contraceptives. There could be nausea, there could be depression, there could be post-pill amenorrhea. You just discover that the woman, is not menstruating. Yes, I talked about weight gain the other time. There could also be weight gain because there is fluid retention. So the woman could continue to gain weight. You'll be wondering what is happening in a situation like that. So when a woman is above a particular, a BMI that is like above a BMI of, let's say, 30 and above, it's not advisable for them to take oral contraceptive pills because it has tendencies to increase their BMI. And obese patients, people that are big, women that are fat, it is not advisable that they take oral contraceptive pills or hormonal methods of family planning. Headache, migraine, breast tenderness, it's not, when there is breast tenderness, it needs to be looked into. So I don't just want to say breast tenderness on its own like that. So it needs to be looked into. So these are adverse effects that could come as a result of using oral contraceptive pills. And the pills should primarily be used for spacing children. You want to space your children before you have another child. before, you want to prevent pregnancy, those over 35 years of age, actually it's not advisable for them also to use or take oral contraceptive pills. Okay, so we are going to talk about Depo. This is a long-acting hormonal injectable that I talked about. So the drug is long-acting because it